Hello everyone and welcome to today's lecture. Today, the topic is about health enhancing behaviors, exercise and weight control, health protective behaviors and illness management. The objectives of my topic are understanding the concept of health behaviors, understanding the dimensions of health behaviors, understanding the concept of exercise and weight control as health enhancing and protective behaviors, understanding the application and importance of these health enhancing behaviors, understanding the concept of illness management, and understanding the effectiveness of illness management. The term health behavior or health related behavior is used very broadly to mean any behavior that may affect an individual's physical health or any behavior that an individual believes may affect their physical health. Interest in behaviors that have important impacts on our health and well-being is based upon two assumptions. A. That a significant proportion of mortality from the leading causes of death is caused by the behavior of individuals, and B. That such behavior is modifiable. Behavior is held to exert its influence on health in three basic ways: by producing direct biological changes, by conveying health risks or protecting against them, or by leading to the early detection or treatment of disease. A distinction is often made between positive and negative health behaviors. Examples of positive healthy, healthful or health-enhancing health behaviors are taking regular exercise, going for annual health checks, eating at least 5 portions of fruit and vegetables a day, and using a condom with new sexual partner. Negative, unhealthy, risky, health compromising or health impairing health behaviors would include, for example, smoking, drinking heavily, driving too fast and eating a diet high in saturated fat. In many cases, this is simply a matter of framing. All these behaviors can be thought of as dichotomies that have a positive alternative and a negative alternative. For example, going for annual health checks versus not going for annual health checks, or smoking versus not smoking. Distinction has also been made on health behaviors and illness behaviors. If a person who has suffered a heart attack takes up regular exercise, perhaps on the advice of his doctor, this could be referred to as an illness behavior because the person has a medically diagnosed illness or condition. If the same person has started exercising before he had his heart attack, the term health behavior would be more appropriate. Even though the behaviors may be defined in exactly the same way, the determinants of illness behaviors may be different from the determinants of health behaviors. Many other types or dimensions may be important. For example, detection behaviors versus prevention behaviors. Public behaviors, for example, going jogging versus private behaviors, for example, exercising at home. And behaviors that involve the use of health services, for example, going for a mammogram versus those that do not, example, breast self-examination. Promotion of healthy lifestyles has been gaining popularity as a tool for developing public health. Studies indicated that healthy lifestyles enhance lifelong health, increase quality of life, and decrease morbidity and mortality. On the other hand, unhealthy lifestyles result in chronic diseases such as high cholesterol, osteoporosis, chronic heart disease, hypertension, colon cancer, and psychosocial health problems. Health-promoting lifestyles include activities that are focused on improving the level of well-being. The focus of these activities is on the development of positive potential for physical, social, mental, intellectual, or spiritual health. Considering this multidimensional structure of health promotion, for example, physical, social, and mental intellectual, 6 health-promoting behaviors have been identified. These are: number 1 is exercise behavior, number 2 is health responsibility, number 3 is life appreciation, number 4 is stress management, number 5 nutrition, and number 6 social support. Now, let me first talk about exercise as health enhancing behavior. Exercise is physical activity that is planned, structured and repetitive for the purpose of conditioning the body. What is purpose of exercise? Exercise is essential for improving overall health, maintaining fitness and helping to prevent the development of obesity, hypertension and cardiovascular disease. Surveys conducted by the Centers for Disease Control and Prevention, that is CDC, indicate that 61.5% of children aged 9 to 13 years do not participate in any organized physical activity. For example, sports, dance classes, and 22.6% are not physically active during their free time. According to the American Obesity Association, approximately 30% of children and adolescents aged 6 to 19 years are overweight and 15% are obese. A sedentary lifestyle and excess calorie consumption are the primary causes of this increase in overweight and obesity. Regular exercise is considered an important factor in controlling weight. Overweight and obese children and adolescents are at higher risk of developing several medical conditions, including asthma, diabetes, hypertension, orthopedic complications such as hip and knee pain and limited range of motion, cardiovascular disease, high cholesterol, sleep apnea, psychosocial disorders such as depression, negative body image, and eating disorders. Clinical studies have shown that regular exercise has numerous benefits, including preventing weight gain and maintaining healthy weight, reducing blood pressure and cholesterol, improving coordination, improving self-esteem and self-confidence, decreasing the risk of developing diabetes, cardiovascular disease, and certain types of cancer. Increase life expectancy. Exercise consists of cardiovascular conditioning, strength and resistance training, and flexibility to improve and maintain the fitness of body's heart, lungs, and muscles. Cardiovascular conditioning. Cardiovascular conditioning involves moderate to vigorous physical activity that results in an elevated heart rate for sustained period of time. Regular cardiovascular exercise improves the efficiency of functioning of heart, lungs, and circulatory system. Strength and resistance training. Strength and resistance training increases muscle strength and mass, bone strength, and the body's metabolism. Strengthening exercise increases muscle strength by putting more strain on a muscle than it is normally accustomed to receiving. Strength training can be performed with or without special equipment. Flexibility. Flexibility is important to improve and maintain the joint range of motion and reduce the likelihood of muscle strains. Most young children are naturally more flexible than older children and adults. Now, we will discuss about the precautions and preparation and aftercare that should be taken while exercising. First, precautions. Before a child begins any exercise program, he or she would be evaluated by physician in order to rule out any potential health risks. Children and adolescents with physical restrictions or certain medical conditions may require an exercise program supervised by a healthcare professional, such as physical therapist or exercise physiologist. If dizziness, nausea, excessive shortness of breath, or chest pain occur during an exercise program, the activity should be stopped and physician should be consulted before the child resumes the activity. Children and adolescents who use any type of exercise equipment should be supervised by a knowledgeable fitness professional such as a personal trainer. Preparation. A physical examination by a physician is important to determine if strenuous exercise is appropriate for detrimental. Prior to beginning exercise, a proper warm-up is necessary to help prevent the possibility of injury resulting from tight muscles, tendons, ligaments, and joints. Appropriate warm-up exercise include walking, light calisthenics, and stretching. Aftercare. Proper cool down after exercise is important and should include a gradual decrease in exercise intensity to slowly bring the heart rate back to normal range, followed by stretches to increase flexibility and reduce the likelihood of muscle soreness. Following vigorous activities, that involve sweating, lost fluids, should be replaced by drinking water. We can further say that exercise behavior within the health promotion has critical role due to strong association of it with other health promoting behaviors. This association implies the enhancement of other health promoting behaviors by the development of a regular exercise habit. Therefore, to improve the physical activity levels of at-risk populations, firstly, understanding the physical activity pattern by using the exercise adherence theories and then eliminating the perceived ecological barriers to exercise, interpersonal, institutional, public, policy and physical environmental are recommended. Now, let us discuss weight control as another health enhancing behavior. Weight control can be described as the act of controlling or directing one's body weight. Weight control as it relates to the nursing process is defined by the Center for Nursing Classification and Clinical Effectiveness (CNC) as facilitating maintenance of optimal body weight and percent body weight. Other terms associated with weight control includes terms such as weight reduction, weight loss programs, diet plans, and weight management. Weight management will be defined as the process of weight reduction or prevention of weight gain. It is a means to improve one's health by reaching an ideal body weight based on one's age and stature. Additionally, weight management is defined as strategies based on a comprehensive lifestyle approach utilizing the combination of dietary, physical activity and behavior modification to achieve the weight loss goals with methods for motivating and educating patients to maintain a lifelong practice. There are various factors that affect weight and leads to overweight or obesity. Some of these factors may make it hard for you to lose weight or avoid regaining weight that you have lost. Family history and genes. Overweight and obesity tend to run in families, suggesting that genes may play a role. Your chances of being overweight are greater if one or both of your parents are overweight or have obesity. Your genes may affect the amount of fat you store in your body and where on your body you carry the extra fat. Race or ethnicity. Some racial and ethnic minority groups are more likely to have obesity. Obesity rates in American adults are highest in African Americans, followed by Hispanics or Latinos, then Caucasians. This is true for men and women. While Asian American men and women have the lowest rates of obesity, they can still be at risk of diseases associated with obesity if they carry a lot of unhealthy fat in their abdomen, even when their body mass index is lower. Now, age. Many people gain weight as they age. Adults who have a normal BMI often start to gain weight in young adulthood and continue to gain weight until they are aged 60 to 65. In addition, children who have obesity are more likely to have obesity as adults. Coming to sex. A person's sex may also affect where the body stores fat. Women tend to build fat in their hips and buttocks. Men usually build up fat in their abdomen or belly. Extra fat, particularly if it is around the abdomen, may put people at risk of health problems even if they have a normal weight. Eating and physical activity habits. Your eating and physical activity habits may raise your chances of becoming overweight and having obesity if you eat and drink a lot of food and beverages that are high in calories, sugar and fat. Drink a lot of beverages that are high in added sugars. Spend a lot of time sitting or lying down and have limited physical activity. Where you live, work, play and worship. Where you live, work, play and worship may affect your eating and physical activity habits and access to health, foods and places to be active. For example, living in an area that has high number of grocery stores can increase your access to better quality, lower calorie foods. Living in a neighborhood with lot of green spaces and areas for safe physical activity may encourage you to be more physically active. Where you work and worship may also make it easier for you to eat unhealthy, high-calorie foods. Vending machines, cafeterias, or special events at your workplace or place of worship may not offer healthy, lower-calorie options. Whenever possible, choose a healthier options and limit your treats to smaller silver or pie or cake. Family habits and culture. Family eating and lifestyle habits may affect your weight and health. Some families may consume foods and beverages that are high in fat, salt, and added sugars, or eat large amounts of unhealthy foods at family gatherings. Some families may also spend a lot of inactive time watching TV, using a computer, or using a mobile device instead of being active. Your social, ethnic, or religious group culture may also affect your weight and health because of shared eating and lifestyle habits. Some cultures may consume foods and beverages that are high in fat, salt, and added sugars. Some common food preparation methods, such as frying, may lead to high calorie intake. Regularly consuming foods high in calories, fat, and sugar may lead to weight gain over time. Not enough sleep. People who don't get enough sleep may eat more calories and snack more. Experts recommend that adults aged 18 to 64 get 7 to 9 hours of sleep a day, and adults aged 65 and older get 7 to 8 hours of sleep a day. Now, other factors. Other factors that can lead to weight gain include certain medical conditions, certain medicines, binge eating disorder, stress. Coming to principles of healthy weight loss. Every legitimate nutrition expert, whether a popular diet guru or a representative of the medical nutrition establishment, agrees that there are some fundamental principles of healthy weight loss that apply to everyone. No matter how much they are disguised, these principles are at the core of every good diet plan, be it a dietitian's plan or a bestseller's. And nobody achieves permanent weight loss and optimal health without obeying these principles consciously or unconsciously. While there appears to be no single right way to eat for health and weight loss on the levels of details, you need to be aware of the basic principles. This will help you avoid those diet plans that do in fact break them and choose the specific plan that is best for you. First one is balance. Nutrient imbalances of various sorts can lead to weight gain, and conversely, improving nutrient balance can facilitate weight loss. Number second, nutrient timing. A spate or recent research has shown that when we eat is almost as important as what we eat with respect to optimizing our body composition. We have learned that it's essential to coordinate energy intake with energy expenditure. Calories are put to the best possible use when they are consumed at times when there is a strong demand for them in the body. Third, self-monitoring. Research has shown that simply paying attention to what you eat is one of the more effective ways to reduce your caloric intake. Number 4, selective restrictions. No weight loss diet can succeed without restriction of the foods that are most responsible for creating large body fat and stores. A majority of mainstream nutrition experts agree that the bad fats found in many processed foods and animal foods and the bad carbs in sweets and processed foods are the primary culprits. Number 5, low caloric density. The concept of caloric density or energy density refers to the number of calories per unit volume in a given food. A food that packs a lot of calories in a small area is said to have high caloric density. Because water and dietary fiber are non-caloric, foods that contain a lot of water and or fiber that tend to have low caloric density. Generally speaking, processed foods are calorically dense, while fruits and vegetables with their high water and fiber content are less dense. Number 6 is consistency. Healthy eating is not like a vaccine. One shot and you are covered for life. Instead, it requires a daily, lifelong commitment. There is growing evidence that the more consistent you are in your wholesome eating habits, the greater your chances of maintaining a healthy body weight. Number 7, motivation. It is often assumed that successful dieters have more inherent willpower. Now, let me talk about another aspect of our well-being, that is illness management. Illness management is an approach to healthcare that teaches patients how to manage a chronic disease. Patients learn to take responsibility for understanding how to take care of themselves. They learn to avoid potential problems and exacerbation or worsening of their health problem. Illness management refers to the use of an explicit, systematic, population-based approach to identify persons at risk, intervene with specific programs of care, and measure clinical outcomes. Illness management has three parts. A. Knowledge base that quantifies the economic structure of a disease and includes guidelines covering the care to be provided by whom and in what setting for each part of the process. A care delivery system without traditional boundaries between the medical specialties and institutions, and a continuous improvement process which develops and refines a knowledge base, guidelines and delivery system. Illness management is an approach to patient care that emphasizes coordinated, comprehensive care along the continuum of disease and across the healthcare of delivery systems. Illness management is generally defined as a comprehensive, integrated approach to care and reimbursement based on a disease's natural course. The goal of illness management is to address the illness or condition with maximum effectiveness and efficiency regardless of treatment settings or typical reimbursement. It is an intervention designed to manage or prevent a chronic condition using a systematic approach to care and potentially employing multiple treatment modalities. It is a system of coordinated healthcare and interventions and communications for populations with conditions in which patient self-care efforts are significant. Now, components of illness management. The Illness Management Association of America identifies these components. First, identify the target population, which diseases should be addressed and how can people with those conditions be enrolled in a disease management program. Establish evidence-based practice guidelines for the conditions that will be managed. Build collaborative practice models. In addition to physicians, disease management programs utilize nurses, dietitians, pharmacists, and other team members. Educate the patient. Design a program to teach self-management to patients. Measure outcomes. Establish procedures for tracking cost, utilization, health outcomes. Feedback and reporting. Conditions targeted for illness management. The conditions are often ones that are included in an illness management program. Heart diseases including congestive heart failure, coronary heart diseases, and hypertension. Lung diseases including obstructive pulmonary disease, liver diseases, diabetes, psychiatric disorders such as clinical depression, Alzheimer's disease or other dementia, cancer, arthritis, osteoporosis, sleep apnea, obesity, asthma. Now, let me make it clear what the research has revealed about the effectiveness of illness management. In late 2007, the first reports on cost control through illness management showed that costs were not being controlled. This failure to achieve the primary goal of instituting these programs were alarming. But there were positive results for patient satisfaction and improvement of their quality of life with illness management programs. The Medicare Health Support Project focused on people with diabetes or heart failure. A report comparing 163,000 patients with a control group found that the illness management programs did not reduce hospital admissions or emergency room visits. There were no savings in Medicare expenditures for these patients. However, a randomized trial of illness management for chronic obstructive pulmonary disease conducted by the Veterans Administration found a decrease in emergency room visits and hospitalizations and a cost savings. Systematic reviews of illness management programs have not shown consistent cost savings or improved patient health outcomes. This may point to the need to improve the illness management program so they are more effective for both the goals. There is an illness management and recovery program that has been devised to help people set meaningful goals for themselves, acquire information and skills to develop more mastery over their psychiatric illness and make progress towards their own personal recovery. IMR is an evidence-based practice and is designed for almost anyone who experiences symptoms caused by a major mental illness. Specifically, research and educational materials cover 4 areas of symptoms: schizophrenia, schizoaffective disorder, bipolar disorder, major depression. The program can be provided in individual or group formats and generally lasts between 5 to 12 months. Now talking about the goals of IMR. Instill hope that change is possible, help people establish personally meaningful goals, teach information about the mental illness and treatment options, develop skills for reducing relapses, dealing with stress and coping with symptoms, provide information about where to obtain needed resources, help people develop or enhance their natural supports for managing their illness and pursuing goals. Now coming to key features of IMR practice. Emphasis on consumer-centered recovery goals. Mutual responsibility in planning and pursuing goals rather than following treatment. Focus on clients' context of life rather than just on their symptoms. Strength versus problems. Encourages the involvement of significant others. Emphasis on the outside practice of skills. 5 empirically supported methods for improving illness management. Psychoeducation about psychiatric disorders and their treatment, cognitive behavioral approaches to improve medication adherence, relapse prevention training, coping skills training, social skills training to improve social support. This brings us to the end of the topic. Thanks for watching.